So we've already talked about different things that microorganisms need to grow. Now we're going to flip that around and what are the ways that we can kill the organisms? So we learned how to grow them, now we got to learn how to kill them. So in this PowerPoint we're going to talk about just going through a little bit what are some goals of antimicrobial control. Sometimes it's not to kill anything and everything, it's just to inhibit growth. We're going to talk about some of the physical methods that we can kill different organisms. We're going to talk about how different organisms work to kill. They don't all kill the exact same ways. We're also going to talk about some physical methods to kill organisms like radiation, and then we're going to talk about different chemicals that can destroy microorganisms and go over some of those chemicals that are commonly used at home as well as in the healthcare setting. So, controlling microorganisms. Again, we know microorganisms can be harmful, not all of them, but it's past history, and eventually when they figured out that there were small organisms out there, they realized that those little small organisms, whatever they thought they were, did need to be controlled. And so they started using different control mechanisms to kill those organisms. Just basic things like using different herbs, perfumes, vinegars, burning wood that released formaldehyde. They knew that it had antimicrobial properties to it, even if they didn't know how it worked. Now, the picture that I have on there too is out of your textbook as well, is the old costume and mask that doctors and physicians used to wear during the plague. They would fill that nose, that little beak part, with various herbs, various chemicals. They thought to try to stop the bad air. It's just interesting now with COVID-19 how this particular image has surfaced again. Well, we know we need to stop it, and we're not wearing crazier costumes. Masks can do the same thing. But we're going to go over different ways we can control them. So some considerations when we're trying to choose any type of microbial control is what are the methods available? You know, can we do some type of physical, chemical, mechanical method to destroy them? And then what are we trying to kill? Are you trying to kill some type of bacteria, some type of fungus, a protozoan, some type of parasitic worm, a virus, a prion? You know, I'm like, what are you trying to kill? Because there are different methods to kill different organisms. Some of them are harder to kill and require very strong, very tough antimicrobial agents. But we are going to first kind of go over what are some of these control methods. We're going to talk about some physical agents, different physical ways we can kill them, including using heat. And there's dry heat and moist heat. And I always tell students this is not a great lecture if you don't like the word moist, because I say it quite a bit in part of this PowerPoint. So there's dry heat and moist heat, and we'll talk about different methods. We're going to talk about using radiation and a couple different types of radiation to control microorganisms. We're going to talk about how we can physically remove them using filters, using different type of gases, as well as different types of liquids and different antimicrobial agents that can inhibit microbial growth. Now, some terms when we talk about controlling microbial growth and disinfection and sterilization, as well as a few others coming up. They are different words because they do mean different things. So disinfection is destroying or removing pathogens, but it's not sterilization. The idea in disinfection is you're destroying most pathogenic organisms, but not everything. And so usually disinfectants are used on inanimate objects like a table, counters, anything in some type of doctor's office. They can spray things down. And I'm like, you're just removing pathogens, but not all of them. Sterilization is killing everything. It is removing all living organisms. And we can also use that on mostly inanimate objects as well. Antisepsis is some type of chemical that's applied to a body surface to destroy or inhibit vegetative pathogens, not as in that picture that I found was kind of funny. But this is something that we would put on the body maybe before surgery to inhibit some type of microbial growth. Now, different organisms, as I said, you got to know what you're trying to kill before you start just grabbing any type of disinfectant or using some type of antimicrobial control. Different things are harder to kill. There are a group of organisms that are highly resistant. Any kind of prion, any type of bacteria that can make an endospore. And the top two bacterial genera that can make endospores, Bacillus and Clostridium, which means they are going to need something stronger to kill them. A moderate resistance, this is going to be most pathogens. So it's going to be protozoan cysts, the naked viruses, bacteria that don't have the endospores, and then some examples, the Mycobacterium, Pseudomonas, and some tough or hard to kill Staphylococcus bacteria. The least resistant, meaning these are the easiest to kill, are most bacteria vegetative cells, meaning they're undergoing reproduction, fungal spores, yeast, envelope viruses, and various protozoans. So they're easier to kill, so they usually require not quite as strong of a disinfectant. Now, the endospore, as I said before, that yes, they are harder to kill, and anything that's in that Bacillus or Clostridium genera, they can make endospores. And they are going to need a strong sporocidal agent. Now, like something that's going to kill the toughest things, including those bacteria that can make endospores. This is just showing examples of different methods and how we can kill organisms, and how any kind of organism that can make a endospore, it's harder to kill. Most bacteria, we can kill them at 80 degrees Celsius moist heat temperature. Endospore, you're going to need to way up that to 120. Radiation, normal bacteria, you need 1,000 grays in the X-ray dosage. Endospore, 4,000. And I'm like, the strength of gas is going to be increased with endospores. How long various liquids have to stay on them is a whole lot longer. So I'm like, endospores are hard to kill. And so if we ever suspect a patient has some type of bacteria that can make an endospores, you're going to need the strong methods to kill those bacteria. Now, as I said, there are some terms that come with controlling microbial growth. One of them is the sterilization, destroys everything. Another one that you hear quite often is sanitization. It's like, oh, I sanitized it. And everyone's like, oh, it means it's totally clean. Well, it's not sterile at all. And I'm like, sanitizing something means you're removing microorganisms, but not all of them, as well as any debris from inanimate objects. Washing dishes, you sanitize them. Laundering clothes, you sanitize them. But it doesn't mean you remove everything. They are not sterile. Disinfection, meaning you're destroying pathogens on inanimate objects. Antisepsis, these are things applied to the body that are going to inhibit microbes from growing. These are going to be the things that they would put on you before some type of surgery. I was going to say asepsis, just preventing the entry into sterile tissue. So anything that we can clean that might have contact with an open sore, you want to prevent those organisms from getting in those open wounds. So I'm like, different terms. So again, sterilization is what we should be aiming for in the healthcare setting. It's not always going to happen. We should be aiming for it, removing all viable microbes that might cause any kind of disease. Now, we again need to know if we're going to use any of these antimicrobial agents. Well, we need to make sure that they actually die. And so sometimes it's hard to detect, did they die? Did they not die? Maybe they were just inhibited for a while, so we got to make sure it's a permanent loss, that they're not just staying dormant for some period of time. And so some of the factors that we need to consider when we're trying to determine how long of something, how warm of something that we're going to need to try to kill everything is, well, how many microbes are we looking to kill? Are we looking to kill 1 million? Are we looking to kill 10? That can change how long the disinfectant is on a surface. That could change how long you need, or how strong some type of antimicrobial agent has to be. What is the nature of the microbes in the population? Are they Do they have everything they need? Are they happy? What is the temperature? What is the pH of the environment? What is the concentration or dosage of the agent that you want to use? What's its mode of action? And we're going to get into some modes of actions of that particular agent. And are there any solvents around, organic matter, or inhibitors that might inhibit different agents from working correctly at inhibiting microbial growth? Now, just looking at a couple factors that can affect death rate, and I'm like, well, how long some type of disinfectant is in contact with those microorganisms is going to affect the death rate. The longer an antimicrobial agent is exposed to microorganisms, the longer, and I'm like, you're going to kill more. So the longer that antimicrobial agent is exposed to those bacteria, and I'm like, you're going to be able to sterilize or hopefully get to that sterilization step that you're going to kill everything. And I'm like, what is, I was going to say, the load? And I'm like, how many microorganisms are there? If there are more microorganisms, it's going to take a longer time for sterilization. Less microorganisms, less time. What kind of organisms? Can they make those endospores or not? If they can, it's going to take a whole lot longer time to kill those organisms versus non-endospore bacteria. And then what kind of agent are you going to use? A microbistatic agent stops microbes from growing, but it doesn't kill them. So when you add it, it stops them, but they can at any point, and I might start growing again. That was once you remove that agent. Microbicidal agents means they're there to kill microbes. And so if you use a microbicidal agent, you're going to eventually kill the organisms. So different factors that can affect different death rates. Now, some concerns when we're controlling microbes is we want to know, does the application require sterilization? Do you have to kill everything? Is the item going to be reused or is it going to be tossed? That might depend on what type of control method you're going to use. Some various things will damage different types of surfaces. Can the item withstand heat? Certain plastics can't withstand extreme heat. Can they withstand pressure? Can radiation or different chemicals? Is the method suitable for the particular situation that you want it to be? Will the agent penetrate to the extent that you want it to? Can it actually get to the microbes that you want to kill? And then, is it cost and labor efficient? And is it safe? Like, is it going to be cheap enough that we can use it on a regular basis? And of course, is it safe for whoever is using it and for the people that might possibly going to have to use some type of medical equipment afterwards that might have that chemical on it? Now, I said we get to it, but different agents kill in different ways. I mean, heating kills differently than some type of bleach solution. Like, there are different methods or modes of action. And so this is looking at what are some mechanisms of microbial drug actions. Now, we're going to get to drugs in the next chapter, but it's the same thing. There are different mechanisms of actions. There are certain things that kill microbes because they inhibit the cell wall. And these are just examples of different drugs. So these are all ones that you would ingest. And I'm like, obviously bleach you're not going to ingest, and heat and things like that. But there are different mechanisms of action. Some inhibit cell walls. Some inhibit protein synthesis. Some inhibit the plasma membrane. Some inhibit various metabolic pathways that they can't make their end result. Some inhibit the making of DNA or RNA. And some inhibit a pathogen's attachment to or recognition of a host. Because for a lot of organisms, if they can't attach to a specific cell or a specific host cell, they can't get in. And if they can't get in, they're not going to cause any issues. So there's different ways we're targeting organisms and how to kill them. So this again is just talking about some of those methods that, yes, if you target the cell wall is there to keep everything in, to give it a nice, a nice strong structure. If you damage the cell wall, it becomes fragile. Just like if you damage the wall of a building, it would become fragile. It's more likely to fall apart or break apart. That's cell lysis. The cell membrane, it loses its integrity. And so I'm like, it's there to regulate what goes in the cell, what goes out of the cell. If it can't do that, stuff's going to get in that's not supposed to, stuff's going to get out that's not supposed to. So again, if you somehow damage that phospholipid bilayer, it's not going to be able to do what it's supposed to do anymore. We could also be damaging the making of proteins or nucleic acids. Again, proteins are needed for everything. I mean, everything structural material-wise is protein. Your enzymes are proteins. If you don't have proteins, and I'm like, you're not going to survive. So if we can deny microorganisms from making the proteins they need, they're going to die. Nucleic acid synthesis, that's your DNA or an RNA. Again, that's the building blocks of life. If an organism can't make more DNA or more RNA, they're definitely not going to be replicating or reproducing, and so we ultimately will kill them off. Now, with protein function, it's not just stopping proteins from getting made. We can sometimes, with different organisms, change proteins that are already made. Anytime you change a protein, you denature it, which means, and I'm like, it can't do its job. And so I give a couple examples of different things that can stop making of proteins and nucleic acid, and various things that can disrupt proteins. Now, some of the physical ways that we can kill them. I'm like, we can use heat, and there's moist heat and there's dry heat. Gotta keep saying the word moist. We can use the opposite. Instead of heat, we can reverse it and make it cold. We can do desiccation. These are some of my next slides coming up. We can also do radiation, or use radiation, and we can also do filtration. Again, we are removing microorganisms one way or the other. So we're first going to start talking about heat. Heat is quite effective at getting rid of microorganisms and inhibiting microbial growth. Now, moist heat is any type of heat that also includes some type of water in anywhere in its method, its process. Now, moist heat is more effective than dry heat. And so this is just showing some of the examples of the temperatures that are needed. The lower temperature, 121 compared to 134, it requires a longer time for sterilization. But once you get up to dry heat, if we compare those two temperatures, 121 degrees without the moisture, 600 minutes versus 15. And so moist heat is more effective at inhibiting microbial growth to the point of sterilization. Now, so dry heat requires a higher temperature, but sometimes it's easier, and we use dry heat quite often. So a couple examples: moist heat. Most common way we try to sterilize things in labs is using what's called an autoclave. We add pressure, which allows us to the air, to the heat, and to the water that's in there to create a really high pressure steam that we put anything in our little, we've got really big autoclaves. Here's a little tabletop on, but we've got really big autoclaves that we can put moisture in there, increase the heat, increase pressure to 15 psi. And as long as we can get whatever we put inside of there up to the 15 psi to maintain 121 degree temperature Celsius for between 10 and 40 minutes, depending on what we're trying to kill, and we'll sterilize various objects. So we use autoclaves quite often. Now, to ensure that your autoclave worked, most of them do have some type of computer device that lets us know that it got up to that correct temperature for this period of time. But we also do have different devices. One of the most common ones is a specific type of tape that it looks like your regular old masking tape. However, there is a chemical on here. It looks like a really pale white line on the tape. But once that chemical gets up to 121 degrees Celsius for a specific period of time, that white line turns black. And so you usually just put some of this tape on some of the stuff you put in there. That ensures that anything you put in there was autoclaved correctly. It's just a little checkpoint we do. Some other moist heat is boiling. It's one of the oldest methods of using moist heat is we can boil things. Now, if you boil, water boils at 100 degrees Celsius, and if you boil for 30 minutes, it does destroy most non-spore forming pathogens. That means it's not sterile, but it kills a lot of pathogens. So it's one of those, if you don't have access to an autoclave, I'm like, boiling is quite effective if you can boil it for 30 minutes. We also use pasteurization as another example of moist heat, is we're adding heat at a high temperature for a short period of time to destroy various microorganisms without destroying the flavor of the food. Because foods taste different after you cook it. So we're not looking to cook the food, we're just looking to increase the temperature for a very short amount of time, seconds, so that it doesn't change the flavor of food. And so this is used in a lot of our dairy products, a lot of juices, and various other types of foods. We pasteurize them. So it's not sterilization, but it does kill a lot of microorganisms. It's why those things are also then refrigerated. And so my only note though is there is a type of pasteurization that's called ultra pasteurization, is that you can reduce the time from 15 seconds to 2 to 5 seconds, but you're going to increase the temperature by a lot. And this ultra pasteurization process is a sterilization method. And they say that the flavor can change a little bit, but this actually allows us to sterilize milk. So if you've ever gone grocery shopping, and I ask that the next time you do to check out, it's usually near the milk. Not always though. That you can buy milk on the shelf, not refrigerated. And I'm like, and it'll last for months. Everyone's like, that's so gross. Why would you buy milk that's not in the refrigerator? Well, it was ultra pasteurized, not regular pasteurized, which means you sterilized it. If you don't have any microorganisms in the milk, there's nothing there to break it down that makes it go bad. And it allows that milk to be shelf stable, because there are different areas of the world that don't have refrigerators in their kitchens. Like, they don't have access to milk anywhere they go, so when they buy milk, it has to stay shelf stable for a long period of time. So next time, look around and see if you can find some of that shelf stable milk. Maybe you want to try it. Here's a picture. I was going to say, I thought I had a picture of some of that milk that you can purchase. Now, dry heat, again, not as effective. It's going to require a higher period of time to work. And I'm like, but one of the most common ways we use dry heat, especially in our labs in microbiology, is using an incinerator. It's using a flame, except we use it where we plug it in. We don't like having open flames if we can avoid it. Instead, we plug it in and it heats it up to, it's usually around 1,000 degrees Fahrenheit. And anytime we're trying to sterilize different types of utensils that we use when we're working with bacteria, we can heat them up right inside of there, and it kills microorganisms. So it's a sterilization process. Again, any type of oven. Ovens themselves is a dry heat, and they're very good at killing microorganisms. In ovens, and I'm like, we can put large objects in ovens versus a tiny little incinerator, and we're not trying to burn them. And I'm like, we can usually do it. We can do it for longer periods of time. You can change the temperatures quite a bit. And again, that heat is going to denature and change proteins. Now, flipping it away from heat, instead of using heat to control microorganisms, we can use cold. Now, cold temperatures is a microbiostatic, which means it doesn't kill the organisms, but it just almost stop microorganisms from growing, which is why we refrigerate things all the time. I'm like, we put things in the refrigerator because it slows microorganisms from growing, which keeps your foods longer because you don't have microorganisms growing and destroying them. However, it doesn't stop microbes from growing. If you look at the back of your refrigerator, I dare you to, you might find something that's got microbes growing on it, maybe some type of fungus or who knows what. So refrigeration doesn't stop microbes from growing, but it does slow them. We can also freeze things. Same thing. Freezing doesn't kill microorganisms as well, but it does put them almost to a completely dormant state, which is why, again, foods can stay for a long period of times in freezing temperatures. So we use cold temperatures to preserve food. We can also use it to preserve bacteria in the lab, various types of media in our lab. So we have huge walk-in refrigerators that we used to put our media in. We have huge freezers that can stop microbes from growing. Now, another physical method other than temperature is desiccation. It's drying things out. It's removing the water. Cells, microbes, need water just like we need water. And if you remove the water, they can't function correctly. Doesn't mean it's going to kill them, but it can put them almost into a dormant state. It again is why foods, when you dehydrate them, last a whole lot longer. You've denied those microorganisms the water that they need. However, when water is reintroduced, those microorganisms can start to grow again. Now, a certain type of drying out is called lyophilization. It's called freeze drying. It's removing the water and freezing it, and by doing both of them, it puts those organisms into a completely dormant state. Another type of physical method we can use to inhibit microbes from growing is using radiation. Now, there are different types of radiation. There's two groups, ionizing and non-ionizing radiation. The biggest difference between the two, ionizing radiation can penetrate into an object. Non-ionizing radiation is for surface only. So some examples of ionizing radiation, gamma rays, X-rays, and cathode rays, whereas your non-ionizing radiation is your basic UV light. Now, if we can apply radiation to various things, again, we can kill microorganisms. This is why UV light, even sunlight, can kill microorganisms. It's one of the biggest ways or things we're trying to understand is how much UV light, sunlight, is needed to kill COVID-19. Because we know UV light can kill the flu virus. We know it can kill other organisms. It can only kill it if they're on the surface of something, but we know it's a very effective type of radiation to inhibit microbial growth. It's also why if you notice the next time you walk into a Walmart, by their carts, they do actually have a UV light. It's there to kill microorganisms on the surface of their carts. And they also have some antimicrobial wipes. But take a look next time around the carts, and I'm like, they do have a UV light. It's there for a reason. This is showing an example of using radiation to preserve foods. If you applied radiation to raspberries, 5 days later, they look great. And I'm like, if you didn't apply the radiation to the raspberries, 5 days later, they don't look very good. Again, the radiation can kill microbes, and it's microbes that can destroy food. So we use radiation for different types of foods. This is showing an example. It's pallets of apples that are being irradiated with a radiation called cobalt-60, and a machine that emits gamma rays on those. Again, it's killing the microorganisms that would essentially break the foods down before you could eat them. This is also showing how we can use UV light. You can buy one of these if you want. And I'm like, but there are little devices that shoot UV light at your toothbrushes so that the UV light will disinfect your toothbrush. Another method of controlling microbial growth is using filtration. This is just a physical removal of the microbes. Whether it's removing microbes from the air, whether it's removing microbes from a liquid, it's the physical removing of the microbes. We're not killing them, but we're removing them from air or water or some type of fluid. And so I'm like, we use air filters, HEPA filters, to remove microbes from the air. We use Brita filters to remove microbes as well as other contaminants in water. It's just you're physically removing them. Now, chemicals. Like, there's a lot of chemicals that can inhibit microbes as well. Lots of chemicals that are there. And so some are disinfectants, some are sterilants, some are antiseptics, degermers, preservatives. And I'm like, some have desirable qualities, that they're, these are the things we would like all of our chemical agents to be. We would like them to work very quickly in a low concentration. We would like them to be soluble in water or alcohol and be shelf stable. We'd like them to be broad spectrum, means they'll work against a large range of microorganisms and yet have low toxicity to us. We'd like them to penetrate multiple surfaces. We'd like them to be non-corrosive. We don't want them to stain anything. And we want them to be cheap and readily available. So we ask a lot of our different chemicals. And again, the ones we used most often are going to be the ones that fit most of these desirable qualities. Now, we again need to know what we're trying to kill, because we do have different types of antimicrobials that are for high level organisms, intermediate level organisms, and low level organisms. A high level germicide is going to kill those endospores. And it may, if it can kill the endospores, be a sterilant, meaning it can kill anything and everything. It can make something be sterilized. Intermediate level, it's going to kill fungal spores. It's not going to kill endospores. It can kill some of the harder to kill bacillus. It can kill viruses. And low levels is mostly there to eliminate various types of vegetative bacteria, fungal cells, and some viruses. And it's one of those, if we don't have to use a high level germicide, we try not to. We try to use the lowest level chemical that is going to kill what we need to be killed. And so if we can get away with using a low level, because these are things that are going to clean surfaces that our skin touches all the time, it's not going to get in the body, we try to use. So if it can kill what we need to kill using a low level, we're always going to go for the lowest level. Now, some factors before we just start grabbing different chemicals to be used is, well, what is the material that we're treating? What is the degree of contamination? I mean, is it heavily contaminated? What is the time required that this chemical is going to have to sit on a surface? And what is the concentration of the chemical? Do you need a certain strength? Is there a various dilution factor that we need to kill whatever it is that we kill? Now, of course, I had to throw my dog. That's my dog in here. But again, you have to know what you're trying to treat. Are you going to be treating a surface that other people or animals are going to be touching right after? Or is it going to be safe for pets and people after you treat it? So you do have to know, what are you treating? What do you have to be thinking about after you're done treating a surface when you choose a certain chemical? Now, chemical agents that are used in healthcare, I'm going to go over a few of these. But just down the left-hand side here, some of the agents, this is going to show you the targets. You can take a look at this more if you want to in your book. But chlorine, iodine, phenolics, the chlorhexidine, there's alcohols, hydrogen peroxide, various quaternary compounds, soaps, various mercurials, silver nitrate, glutaraldehyde, orthoaldehyde, various types of gases, and various types of dyes. So lots of different types of agents can be used to kill. So going over some of the chemical ones, common ones are halogens. Halogens are very common germicidal agents that are used. The most common ones are chlorine and iodine. And so you can see that we use chlorine in various pools. We can use it to make water drinkable. We can use iodine and betadine, which is an iodine, on surfaces before different types of medical treatments. We use chlorine in water to disinfect water. So very common germicidal agents that are used not just in the healthcare setting, but are germicidal out there, used different places like pools. This is showing an example of using the chlorine. It's some cantaloupes that are disinfected with chlorine to kill any potential bad bacteria like salmonella before they get shipped off to the stores. This is showing some surface getting treated with some of the iodine, a povidone iodine solution before surgery. Phenols, and they're a poisonous compound. Their main job is to disrupt cell walls and membranes. And they're a low to intermediate levels, so they're not going to kill those endospore organisms. But the most common phenol that's used is Lysol. So when you spray everything with Lysol, just know that it's a phenol. It's not going to kill everything. It's a low to intermediate level germicide. This is just showing the structure of phenol. Chlorhexidine, it's a surfactant. So its job is to break apart surfaces to release organisms, microorganisms. So we usually use this on the skin. It's a skin degerming agent. Hibiclens, the hibitane is used a lot of times before surgeries. It's to remove microorganisms, like physically remove them off the surface of the skin. Your alcohols, ethyl and isopropyl alcohol are used all the time, usually a concentration of 50% or more. I usually see 70, if not 95% alcohol to kill. And I'm like, this is your basic alcohol. And I'm like, your hand sanitizer is alcohol based. So, and I'm like, all the time, if you can't physically wash your hands to remove the organisms off of your hands, it's using alcohol on your hands to try to kill the organisms that are remaining. Hydrogen peroxide, it is in itself, I'm like, it releases a toxic oxygen gas that for a lot of organisms it's toxic, it kills. They can be sporicidal, which means they can be a very strong disinfectant. However, it can do damage to different surfaces and structures, and if it gets in and on skin, it can do damage and be irritating as well. So I'm like, it is effective in the right circumstance. The aldehydes, so glutaraldehyde and formaldehyde, they stop proteins and stop DNA from being formed. These are high-level disinfectants. Their main job is to stop and inhibit all microbial growth. I have the picture down on the bottom that I found. If you ever had a science teacher, in high school or middle school, they probably had a whole bunch of bottles. And you ever wondered why those things that, those animals, those organisms were able to stay in those bottles for 20, 30, 40 plus years? Well, they were in some type of aldehyde, some type of formaldehyde. Formalin is the safer version of a formaldehyde, but it kills all microorganisms, which means there's nothing to break those organisms down. So they can just hang out in there endlessly. Now, this is just showing we use aldehydes to disinfect various surgical instruments as well that get reused between surgeries. Different types of gases. We don't use gases a lot, but there are certain things, tubing, just different things that you can't throw into an autoclave. You can't spray it with a strong disinfectant. There's just certain instruments that you just can't disinfect any other way than putting it into some gaseous chamber. So we're going to put some type of gas into the chamber with these different instruments, and the gas will inhibit microbial growth. It's there to sterilize those different agents. So this is showing some of the examples of some different medical supplies that we're going to sterilize using a gas. Again, you can't add water to different types of the clips. You can't add water to something that's going to absorb the water, some type of towel or wrap. And I'm like, so we need gas for certain type of instruments. Detergents and soaps. So their main job, like the quaternary ammonia compounds, we shorten it to quats. These are also surfactants. Their job is to try to release microorganisms from the surface. It's not to kill. If something like soap that says antibacterial on it, soap in itself is somewhat antibacterial. It's there to remove bacteria by physically removing the bacteria off the hands using water. But when it says antibacterial soap, there's usually some type of, whether it's alcohol or some type of chemical added to it that's also there to not just remove the bacteria, but to kill any remaining bacteria. So detergents and soaps just are there to try to remove microorganisms from the surface. Now, this is to show non-germicidal soap versus germicidal soap. So a lot of times soap, they are going to add something else to the soap that makes them germicidal. So it's not there just to remove physically the bacteria, it's there to kill as well. And germicidal soap is going to be more effective at removing the bacteria and then keeping them gone for long periods of time. Non-germicidal soap does remove organisms, but the interesting part is you can actually get this increase in bacteria on the surface. And part of that is as you are scrubbing using soap, you can actually get down to a layer where you have your normal flora bacteria. So it's going to look like you actually have more bacteria. You're more just getting to the and swabbing the area under your first layer of skin where you find lots of normal flora. But germicidal soap, and I'm like very effective at getting rid of those bacteria and keeping them gone for a longer period of time. Heavy metals are another of our different types of chemicals. It's anything that has a heavy metal in it. They're a low-level antimicrobial agent, but this is just showing that metals can inhibit microbes from growing. This has got a silver, this has got a gold on there, and if you notice, no organisms are growing around those heavy metals. So I'm like, they're usually used at very low levels so that we don't have any type of I was going to say contamination, because metals in the body are never good when in high concentrations, but low levels are okay, and they have been used in various types of preservatives. I know they used to use, I believe, silver nitrate in some of the original vaccines. Extremely low concentration. It was just to preserve the vaccine so that they could sit on the shelves for months before given and they didn't become contaminated with bacteria. But after everyone thought vaccines caused autism and they're like, well, it's got to be because of that heavy metal, they haven't put heavy metals in vaccines in like the last 20 years. But they did used to use it. Again, it's good at inhibiting microbes from growing. And then our last antimicrobial agents are acids and alkalis. And I'm like, your bases. Again, they're there to inhibit bacterial growth. They slow fungus from growing. They are just going to slow. They're not going to sterilize, but they are going to slow organisms from growing. So again, this chapter, lots of different ways we can kill organisms. My only note, these are all different organisms or different ways to kill organisms, generally on the surfaces. These are not different things that we would use in our body. That's the next chapter. So this chapter is just how can we kill organisms on the surface of things, not on the body, at least internally in the body. So, and I'm like, that's our next chapter.